Hello, everybody, and welcome. Welcome to Ask Dr. Bob. That's where you get to ask me, Dr. Bob Gabe, questions about diabetes, anything that would be helpful. My name is Bob Gabe, and I'm the Chief Scientific and Medical Officer here at the American Diabetes Association, and we are here to help you. So, without further ado, we will get started. And we already, as we do each episode, we often have a theme, and we've already collected a lot of questions on that theme. So, for those of you that may not know, March is Women's History Month. And so, in honor of that, we're really focusing on women's health and diabetes and the things that are particularly pertinent to women. Women have played a huge role in the discovery parts of diabetes, from research and care and all sorts of wonderful things. And I have so many amazing colleagues that have been part of that work. Anyhow, you're not here to hear about that. You want your questions answered. And so let's get started. So, the first question we got is why does or how does diabetes impact women differently than men? Well, that's a good starting point. You know, much of it is very similar. The types of complications, the impact of blood sugars, blood glucose, many of those things are the same. A couple of things that are maybe worth pointing out. One is the risk of diabetes. There's an additional risk factor that we'll talk about, a couple additional risk factors for diabetes that women may have. And one of those is gestational diabetes, diabetes during the late second or third trimester of pregnancy. So, that have had gestational diabetes are at increased risk for diabetes. And so that's a risk factor. And women with something called PCOS, polycystic ovarian disease, PCOS. Women that have that condition are also at higher risk for developing type 2 diabetes. And we'll talk about both of those in a little bit. But so that's one difference for women versus men. The other can be the symptoms that one develops um, in before developing diabetes. So we know that the common symptoms, which may not occur until someone's had diabetes for quite some time, unnoticed. Those common symptoms are excessive thirst and excessive urination. But in women, one of the unique things that they may develop is more frequent yeast infections, vaginal yeast infections, and that could be a sign of having diabetes. Or for women with diabetes, it could be when their blood glucoses are too high for too long, they are more likely to develop those vaginal yeast infections, so fungal infections. So that's another difference of men versus women when it comes to diabetes. Um, and the last one that I'll say is, you know, uh, the women's hormones can affect their diabetes. And we'll talk about more of that in a moment. But particularly one of the hormones, progesterone, that's made in the second half of the cycle, of their menstrual cycle, uh, makes individuals insulin resistant. And so we'll talk about that more in a moment. I don't want to go too deep on that first question. So those are the differences between men and women when it comes to diabetes. The risk factors for developing diabetes, some of the signs in terms of vaginal infections, and the impact of hormones. So let's move to the next question. Um, are women more or less likely to get diabetes? Pretty much the same, with the exception that I said, they have some other risk factors, but the numbers of men and women with diabetes not so different. So That was a quick one. All right. So here's the question that we wanted to, that I said we'd get to. Someone asked, what is gestational diabetes? So, gestational diabetes is diabetes during gestation, during pregnancy, and typically develops in the 24 to 28-week range of pregnancy. So, typically the third trimester of pregnancy or late second trimester is when women who do not have diabetes can develop diabetes. And you might ask, why does that happen? Well, let me tell you. Uh, so it seems to be that the placenta, what feeds the fetus and the baby, secretes certain hormones. And those hormones, uh, uh, human placental lactogen being one of them, the placenta makes hormones that result in women becoming resistant to the effects of insulin. And that sort of happens for all women during pregnancy. And the ones that develop gestational diabetes are the ones that can't make enough extra insulin to compensate for that resistance. So, uh, gestational diabetes, third trimester. Uh, and that's why we screen women for gestational diabetes. They're screened for diabetes later in their pregnancy, pretty much standard. Certainly, anyone with any risk factor for diabetes. And you might say, why is it so important to know that someone has gestational diabetes? Well, two reasons. One, because if it's not diagnosed, uh, it affects both mom and baby. So, mom has much higher risk of developing obstetrical complications, complications due during delivery, during pregnancy, preeclampsia, high blood pressure, a bunch of things. And baby, more likely to be a very large baby, have problems during delivery, of all sorts of things. So, um, one reason to know if someone has gestational diabetes is because things can go wrong if it's undiagnosed. The good news is that with the right treatment, you can reduce all of those risks significantly. So it's important for women to be screened, and then if they have gestational diabetes, get the right treatment to prevent some of those complications that I just described. Um, Let me take a moment and digress a little bit to so one of the things the American Diabetes Association does every year is we publish something called the Standards of Care, and these are the definitive guidelines for healthcare providers around the world that sort of give what's the latest greatest, what do you need to do to ensure that people with diabetes have good health. And there was a big change this year that is particularly pertinent to women and around pregnant. So I want to share that with you all so that you're aware. Um, what we've now recommended is to screen any woman that's planning on becoming pregnant for diabetes, or any woman at her first prenatal visit, sometime before 16 weeks, to see if they had pre-existing diabetes, because many women have diabetes, they don't know they have it, they become pregnant, um, and it's not recognized until they get screened the typical way for gestational diabetes late in their pregnancy. Um, and that can be a big problem, because if you don't know that you have diabetes and you're pregnant, that can also very much affect your pregnancy. So, diagnose early for pre existing diabetes and diagnose in the third trimester to see if someone has gestational diabetes. Okay, let's move to the next question. And this is one more about gestational diabetes. And this person asks, does gestational diabetes often turn into um, full-blown type 1 or type 2 diabetes after pregnancy? So what happens, it's a great question, is these individuals that have gestational diabetes, these women have a high risk of developing type 2 diabetes after pregnancy. So most women with gestational diabetes, after they deliver, their blood glucoses go to normal. They don't have diabetes. But many can now develop type 2 diabetes, not type 1, but type 2 diabetes. Um, and here's a statistic that many people don't know. So, how common do you think it is for women with gestational diabetes to develop type 2 diabetes? 50% of women that had gestational diabetes will get type 2 within 10 years. And so that brings the next question, which is a natural follow up. If there's a high risk of developing type 2 diabetes when you've had gestational diabetes, what can I do about it? Well, fortunately, there's a lot that you can do. Largely, this relates to changes in your diet and exercise. So, there is a program offered nationally called the Diabetes Prevention Program, DPP for short. And that's based on a very large study that showed really effective ways to prevent um, people at high risk for developing diabetes from developing diabetes. And part of that group were women with gestational diabetes. So, what do you need to do if you've had gestational diabetes? Well, the goal is to try to, for women that are overweight or obese, is to try to lose 7% of your body weight. So think of how many pounds you weigh, multiply that by 0.07, that's 7%. Take out your calculator, you'll see how many pounds you need to lose. And if you could do that, you lower your risk of developing diabetes by 2/3. Um, how do people lose that weight? Well, the their attention to the foods that you eat, and the American Diabetes Association website has lots of great tips on how to do that, and foods and recipes on Food Hub that are literally thousands of recipes of all sorts of food of how you can eat healthy. So you can prevent diabetes and lose that weight by attention to your diet and by exercise. And the exercise people did is nothing, it's not like running a marathon. It's walking 30 minutes 3 times a week. Something that I think many of us could incorporate into our lifestyle. So, for those of you that are tuning in late, this is Ask Dr. Bob with me, your host, Dr. Bob Gabbay, Chief Scientific and Medical Officer. We answer your questions this month around women's health in honor of Women's History Month. And our next question here is, what's the best management practice for women living with diabetes? Well, a lot of this is not so different from anyone living with diabetes, but I'll remind you what those things are. Uh, the simple way to remember it are the ABCs. A1C, which is a measure of blood glucose levels, keeping A1C in range. B is for blood pressure, having normal blood pressure. And C, cholesterol. So A1C, blood pressure, cholesterol, ABC. Making sure those numbers are where they need to be. Because one thing that, unfortunately, and I've seen this in a lot of the women that I care for, uh, they don't realize that their risk of heart disease when they have diabetes is really increased a lot. And in fact, their risk becomes sort of equivalent to men. We know that men generally have higher risk of heart disease, but when women develop diabetes, their risk goes up quite a lot. And so that's why it's important to think about the not only the A1C, but the blood pressure and the cholesterol. Um, the other thing that women can do to manage their diabetes um, is make sure that they have the proper screenings for early signs of complication where we can prevent that from getting any worse. So, what is that? That's a yearly eye exam. That's a yearly test of your kidneys, both blood and urine test. That's checking your feet yearly, having your healthcare provider look at your feet and test if you can feel this little wire that gets touched to your foot to see if you can feel that little pressure. It doesn't hurt. It's just a little bit of pressure to see if you could feel it. So those are the things to do. And then when I think about women in particular, it's that preconception counseling. If you're thinking of becoming pregnant, tell your healthcare provider so that they can prepare you to have a safe pregnancy. Why is that so important? Well, it turns out that a lot of the organs of the baby are developed in the first 10 weeks of pregnancy. Many women might not even know they're pregnant those first 10 weeks. And so if we wait to, manage blood glucose well at that point, we're missing those important times where the organs are developing. And unfortunately, if blood glucoses are high, um, they can lead to a variety of congenital malformations, organs that don't form properly. So the answer to that is plan the pregnancy, think about it beforehand, know how your blood glucoses are doing, and work to get them in the right range so that you can have a healthy pregnancy. And when a woman with diabetes becomes pregnant, um, the management of their diabetes is a little bit more intensive during the pregnancy because the stakes are higher. It's not only mom's health, but it's baby's health. And so it's important to connect with a specialist with experience in managing diabetes in pregnant women, whether that is your obstetrician or endocrinologist, but you want someone that has experience in pregnancy and diabetes. Okay, moving right along. The next question I got is diabetes management impacted by hormonal conditions that women may have, like PCOS or menopause? So let me talk about PCOS. PCOS stands for polycystic ovarian syndrome. So PCOS. And what happens in PCOS is simplest way to explain it is that it is a form of resistance to insulin. And as a result of that resistance to insulin, uh, it puts women at risk for developing diabetes, um, but it can also require um, sort of increased insulin or other medications to reduce insulin resistance um, to help manage diabetes. Um, the other thing I'll say in terms of hormonal changes in women and diabetes is two things. One, for women with type 1 diabetes have a high risk of developing hypothyroidism, a low thyroid. And a low thyroid, one of the ways a woman might know that she has a low thyroid is irregular menstrual periods. So there's a connection there. Um, the other thing to keep in mind, and this is true both for women with type 1 diabetes and also women for type 2, particularly at menopause, their risk of osteoporosis, thin bones, and potentially fractures is much higher. So, women with diabetes have a higher risk of osteoporosis than women without diabetes. Okay, we're moving right along here. Um, so here's a really nice question from a mom, and she says, for our moms out there, what are some of the ways that we can stay on top of our diabetes management while raising kids? Well, I don't need to tell you how challenging and busy it is to have kids. And so, first thing I would say is take time for yourself. Um, Moms notoriously do for everybody else, and they come last. And your health is important, and you want to be healthy so you can be healthy for your child as they grow up. So, take time for yourself. Um, uh, get support where you need it, uh, uh, and I mean that as emotional support and mental health support. And again, the American Diabetes Association has some great resources to help you in that realm, and also to help you identify mental health professionals that can help you as well in that. Um, and do things that you need to do to recharge your batteries. Take a little bit of time. I know time is precious when you're a mom, but take a little bit of time to do things, whatever it is that recharges your battery. And uh, uh, Doing a little exercise, going for a walk, whatever that might be. Okay, this is a really important question, and I'm glad somebody asked this. Is it safe for women with type 1 diabetes or type 2 diabetes to get pregnant? And the answer is yes, if you plan it, if you take care of it right. And I can't tell you the number of patients I have that say years ago they were told that they should never have children. Um, that's crazy. Um, what we know is that yes, women with diabetes have a higher risk of pregnancy complications and complications for their babies. But we also know that if those same women can manage their blood glucose levels at a healthy range, they don't necessarily have any higher risk. So it's really about planning and doing the right things to be healthy for both you and your baby. And if you do that and plug into the right care, absolutely no reason not to think about having a child. Okay. The last question I got here in advance was, does menstruation affect my diabetes? And it does. The menstrual cycle does, particularly for most notable for women with type 1 diabetes or women that are on insulin. And my patients on insulin pumps really notice this because they're fine tuning the amount of insulin they take. Um, what typically happens, so the menstrual cycle is a combination of different hormones that are released, reproductive hormones that are released. Um, and what happens in the second part of that menstrual cycle, right at the time of ovulation, is that progesterone is made, and more progesterone is made, and then it drops down. And that's the normal menstrual cycle. Well, that progesterone that keeps rising after ovulation makes one insulin resistant. And that insulin resistance may mean that you need more insulin. And so women may notice that they need to adjust their insulin for the second half of their menstrual cycle and may need to take more insulin. Looks like I got one other question. So, uh, Hashem asked, what are the recommendations for the frequency of blood glucose monitoring for women planning on getting pregnant or that have gestational diabetes? Well, Hashem, thanks for asking that. And, it depends a little bit. So I really want you to speak to your healthcare provider on it. During pregnancy, one of the changes of glucose monitoring is that We are interested in glucose levels before eating, but also 1 hour after eating. And that's not something we measure when women are not pregnant, but it's important during pregnancy. So that's one thing that is worth measuring in preparation for pregnancy. It depends on what kind of treatment you're on. If you're on insulin, probably 3 to 4 times a day of glucose monitoring will be important. Um, if you're on oral medications or non-insulin treatments, once a day might be enough, but changing the time that you do it, not always at the same time of the day. So you have a sense of how you do it different times of the day in terms of blood glucose. So looks like we're out of time. Thank you for sending all of your questions. This is Ask Dr. Bob, Bob Gabe, Chief Scientific and Medical Officer for the ADA. Uh, Please tell your friends and family to tune in each month for this program. Follow me on Twitter, Dr. Bob Gabe. You can find all sorts of useful information there. And until next month, thank you all for joining us and be well.